Hey Wichita, Dr. Dave here again at Engelken Chiropractic and Acupuncture. Today we're going to show you guys what it looks like to have an adjustment in our office. And we've got a special guest today, Devin, who's a longtime patient and a former athlete. So we're going to see what his spine looks like. Let's have you lay face straight down. So the first area I like to look at, I like to go straight to the upper back. With us on our cell phones and being on computers, we've all got those trigger points in our traps and our muscles are all tightened up. So I like to get that released first. So as we go up into his upper back here, we're going to find the spot right there. And we're going to just take the pressure out of that area of his spine. Perfect, just like that. That's exactly what we want to see. What we're doing as a chiropractor is we are looking for vertebrae that are out of position, feeling along there and finding where they're out of position and just gently putting it back in place. That's what we do as a chiropractor. So now we're going to move into the middle back area. This is another common spot when we get tired and we start to slouch. That's the highest point in our back. So a lot of people have this area out in their spine. And we got just a little tiny bit right here on him. Just like that, just a little bit of movement puts it back in place. If you're having stomach problems or indigestion, a lot of that can come from that area too. Now we're going to move down into the lower part of the back. This is the #1 reason why patients see us as a chiropractor is to fix low back pain. Maybe you've heard it called sciatica or SI joint problems. Doesn't really matter what you call it. We've got some kind of problem down in the low back. First thing I look at is the pelvis. This is the foundation of your body. It's not your feet, it's your pelvis. This has to be level for everything else to follow suit. So the first thing I check on this SI joint, they call it that because it's where your sacrum and your ilium meet. So we like to motion into those two joints, and typically you'll find one that's restricted. A lot of times it's on the dominant leg, not all the time, but a lot of times it is. So we've got a fixation or a stuck SI joint, and then a lot of times the opposite side will actually be hypermobile and moving too much because it's been stuck like that for so long. So we'll show you guys what that looks like right here. So we're just finding where that spot is stuck, and perfect, just like that. So when the low back gets off like that, it's going to rotate that lower lumbar. So now we're going to go into that and correct that also. Excellent. That is what we want right there. So now the low back is in place. The other thing I want you to take away from today's video is we've got a lot of patients that have had prior surgeries in either their neck or their low back. You can still have chiropractic care even if you've had a spinal surgery. So whether it's a fusion, microdiscectomy, maybe you've had a laminectomy where they pulled the back of the spine off, you can still have chiropractic. And in my opinion, that's even more reason to see a chiropractor. If you've got two bones that are now fused together and they're not moving, every joint around that fusion has to make up the difference for those not moving. So that joint is going to be prematurely worn out if you're not maintaining it and taking care of it. So yeah, we see surgical patients all week long. So now we're moving up into the neck, another very common area, probably the second most common reason we see patients. Neck pain, headaches, TMJ problems, or what I hear typically on a daily basis is, I think I slept wrong, or I need a new pillow. 9 times out of 10, you did not sleep wrong, you don't need a new pillow, you've got stress in your neck that you haven't gotten rid of, whether it's physical stress, chemical stress, emotional stress, there's something in there that's hanging on that we've got to get released. So let's take a look up into his neck here, and right in here we've got another spot. So we'll show you guys what it looks like to put that back in place. Boom, just like that. We're back in there. So that's what it looks like to have an adjustment in our office. Now we're going to move into some electronic acupuncture. So that's what this little guy here is. What this does is it releases endorphins to help with pain, and it helps you heal faster. So we're going to treat his low back. So I'll show you guys what that looks like here. So we'll just pull the shirt up here, and then we'll set this. And then what the patient actually feels is they actually just feel a little tingle. So instead of using a needle, we're using electricity.